We'll bring you more on the story on the show. Back here in Accra, the government of Ghana is urging ECOWAS to fast-track the process of establishing an early warning center in Ghana to guarantee the security of citizens of member states in the sub-region. The current global health crisis of coronavirus, according to the Vice President, has underscored the urgent need for a center in Ghana as established in some member states. Addressing members of the National Early Warning Task Force at the Jubilee House on Wednesday morning, Dr. Bawumia said a successful implementation of the center in Ghana will also ensure effective coordination among member states in times when violent conflicts occur.
Addressing members here at the Jubilee House, Vice President Mahmoud Bawumia said the government of Ghana is keen on ensuring the institutionalization of the early warning center here in Ghana to prevent destructive crisis in the ECOWAS region.
For some time now, ECOWAS member states and the ECOWAS Commission have been considering effective early warning and response mechanisms in ECOWAS countries to avert destructive crises in our region. The crises that we tend to see have broad effects across all countries, whether it was Ebola that we all had to think about, whether it was SARS, whether it is CSM, we have to, and today we are thinking also of COVID-19. All of these have impacts just beyond one country. The ECOWAS early warning system aims primarily at guaranteeing human security. The system envisages the establishment of a fully integrated and functional early warning system within member states of the ECOWAS. The system is intended to provide timely reports and analysis for effective responses that will prevent and mitigate violent conflicts, amongst others, in the sub-region. With the establishment of national centers, ECOWAS member states will be able to share information, implement conflict prevention, and manage crises while protecting human security at national and regional levels. The center's role is to warn government of threats to human security, propose appropriate action, coordinate, and ensure monitoring of the implementation of response to the warning. In view of the time constraint, I suggest a doubling of efforts and maximum cooperation to get Ghana ready for the assessment and the launch. On its part, the ECOWAS Commission will provide support and logistics to fully equip the center once established. I call on the Ministry of Foreign Affairs and Regional Integration for its maximum support for the work of the task force.
In other news, government is dismissing concerns that the Supreme Court verdict on Martin Amidu will open the floodgate for people who have passed the retirement age to be appointed into public office. Former Deputy Attorney General Dr. Dominic Ayine dragged the Attorney General to court, arguing Mr. Amidu could not hold the office as special prosecutor because he's more than 65 years old. The court, in a majority 5-2 decision, disagreed, dismissing the case. Now, speaking on PM Express last night, the Deputy Attorney General, Joseph Dendiok Benka, dismissed that claim.
A general and categorical statement that 65 years retirement is applicable to all above 65 years you can work in the public sector and etc. That is not what the court said. The court made a distinction between what the Honorable Dominic Ayine was asking for and the office of the special prosecutor. What the court said was that the office of the special prosecutor is a specialized agency, not in the contemplation of 1901 as espoused by the Honorable Ayine. And that has been our position all along. We have argued that that particular position, and even in your intro, you indicated it, we try to draw a distinction between public officer and public office. And we said that the Office of a Special Prosecutor is a special purpose vehicle. It is not one that is contemplated by the said Article 190, as you have actually adumbrated earlier. And the justices of the Supreme Court agreed with that distinction that we drew their attention to, and so held. But they did not in any way endorse that all other public officers, even if they are above 65, should continue to hold office. They haven't said so. And we should not read anything into the judgment apart from what the learned justices of the Supreme Court did say today.
Or you can get more updates of PM Express on Joy News TV, our official YouTube channel. Well, before we go, the Finance Minister, Ken Ofori-Atta, has revealed that the lockdown was not extended because the policy had a dire impact on the informal economy. The impact, according to the minister, made it impossible to continue with the lockdown directive. Speaking at the launch of Maslow's integrated ICT system, an initiative to improve efficiency of the institution, Ken Ofori-Atta said the policy also revealed the vulnerabilities of the economy.
The impact of the COVID-19 on the Ghanaian economy, Finance Minister Ken Ofori-Atta said, given the fact that about 90% of the population are in the informal sector, was part of the reason why the lockdown period could not be extended.
You look at what happened with the lockdown, in which it was quite clear after a point that given that 90% of our population is informal and they go out each day to earn wages, it became increasingly impossible to continue such a policy. And therefore, even as there was reason to unlock ourselves but not let down the protocols, we have to search deep to see how we bring resources for people to be able to do their work on a daily basis. And that has three failings. On the financial side was certainly access to capital, then the price of capital, and then on the distribution side is the issue of digitization.
Well, we're still right here on the AM show on Joy News, and we have to take a break. But before then, it is your birthday. Josephine Amu of the Ghana Maritime Authority. It's from your son, Daniel, who works with the Jospon Group Audit Office, and also from Lady D, your brother, and the rest of the sisters, your in-law Gertrude of Millennium Insurance, and the rest of the family. Please do enjoy your day, and your lunch is on Daniel. Well, we're taking a break. When we come back, we'll do the newspapers, but we also do have the latest weather update right here for you. We'll be joined also by Joseph Akable, bringing to us the latest update. Israel Lai, Evans Mensah, all on the bill. Up next. I'll have to do the newspapers. It's the birthday of Mrs. Dinah Amu of Two Sisters Restaurant just close to Kanda, right here in Accra. It's from Daniel and the rest of the family and your children as well. They're saying that, look, they are going to book an executive table for you right at home. And please do enjoy your day. Two Sisters Restaurant, Kanda, right here. Mrs. Dinah Amu, we say have a good one. And thanks for always watching us. But in the meantime, we have Mama V, Israel Lai, as well as Joseph Akable on stream. Good morning to all of you.
Good morning, Roland Walker. Hello, Izzy.
Hi. Good morning, Mama V.
Yeah. Oh, so, that's
this morning I woke up a bit.
Yeah, the spectacle is going.
Yeah.
I think I think you're more familiar this way.
Looking as fresh as you'd expect me to.
Yeah.
And Joseph Akable, why are you wearing the mask?
Because unlike you guys, I'm in a relatively public place, and so I need to ensure that I'm safe.
Okay.
Safety first.
You know,
yes,
I think sometimes Joseph behaves like a baby with sharp teeth. Sometimes your responses shall be careful.
Well, is that offensive? I didn't think so.
I know.
Okay, guys, it's a Thursday, and we have to run through the newspapers. So I'll be doing the Daily Graphic newspaper. Izzy, what papers would you be taking us through?
I'll be taking the Ghanaian Times.
Thank you. Thank you.
Joseph?
So I'll take you through the Daily Dispatch as well as that of the Finder as well, the Business Finder.
Okay. Okay. All right. So we'll start with
do I
right
start?
here.
All right, so the Daily Graphic newspaper, and this is what the paper is reporting today. Of course, this heartbreaking story. Unbelievable that a father will beat his own child to this extent, as we've seen it play out on social media. We reported it extensively. Rastas Asari Donko giving us details of the stories. On the front page, man 26 arrested for abusing son who's only 3 years. It's not even if he was even older. Nobody should beat a child like that. I mean, why do you even beat a child in the first place? Ugandan scientists research into COVID-19 drugs, but the banner headline, Amidu eligible as special prosecutor, Supreme Court rules, comes with a smiley picture of the special prosecutor, Mr. Martin Amidu. There you go, with what's on the front page of the paper today. Let's do the center spread. Effective early warning response mechanism guarantees security. That's according to Vice President Baumia. GES, others donate food items to prison service. And Guta calls for implementation of airport disinfection system. On the back page of the paper, rainstorm destroys Kukobela Nasia farms and 2 body support projects to reduce plastic waste. Those are the 2 stories on the back page of the Daily Graphic newspaper.
Okay, so I'll take the Ghanaian Times. So the Martin Amidu story is also here. It says age eligibility suit. Martin Amidu fit for special prosecutor, Supreme Court declares. 10 perish in 2 separate accidents at Brimso Apam Junction. And investigate 533 confirmed COVID-19 cases at Tema Fish Processing Plant. And Cameron Dodu urges government. Mondele Child Right International support COVID-19 fight. And then on the back page of the Ghanaian Times, Direct Aid Ghana provides mechanized borehole for Tamale Central Prisons. And the Mondele Child Rights International story is also on the back page. And then in the center spread, we have 25 MDAs receive 30 waste containers. And we also have, so the fish processing story investigation comes in the middle spread. And then that accident at Brimso also is in the middle spread. Yeah. So, and then they're also talking about the Ghana's COVID-19 cases pushes to 5,408. So that's for the Ghanaian Times.
We can do the front page of the Daily Dispatch now. A number of stories there. One related to the Electoral Commission. It says EC's tender for 1.9 million gloves and 138,359 nose mask closes tomorrow. And judgment on the NCA case is also on the front page of the Daily Dispatch. Evaluation reports on herbal medicines for COVID-19 submitted to government. And ongoing extra accommodation for military to cost $100 million. The back page of the Daily Dispatch has a story, the minority responding to the EC's statement and towards a new voter register. EC's tender for 1.9 million sterilized gloves. That story is on the back page of the Daily Dispatch paper.
All right, so let's go to the Daily Guide. I have here with the Daily Guide the front page story. Supreme Court clears Martin Amidu as Ayariga cries foul. Alote sees Tamils and prostitute kills man after sex. That is also on the front page. On the back page, obviously has to be full of sports. The back page of the Daily Guide. No decision yet on football, even though Germany is expected to begin football related activities this weekend. We don't have it right here in our country yet. Yeah. It's very much understandable. Duncan can point out my wrongs. Now, FA drags FIFA to court over Chelsea ban. I'm not talking the Ghana FA, the Football Association of England. Murdered journalist fiancé fights Newcastle owners. We're talking the fiancé of murdered journalist Jamal Khashoggi has written an open letter to Newcastle United fans asking them to consider if the club's pending takeover is the right way out of despair for them and the city. We know that there's a consortium that's also owned by Prince Mohammed bin Salman of Saudi Arabia that is having a takeover of Newcastle United. And of course, after that takeover, for those who love football, Newcastle United will become one of the football forces to be reckoned with in England. All right. Okay, so we do have the statement also about Martin Amidu and the rest of the story. Okay, any pick for any of us at all? Joseph, Israel, Mamavi, where do we want to start from?
Oh, we've got Evans joining us. Hi there.
Ah, Evans.
Yes. Hey.
How are you?
I'm doing great.
I watch you on PM Express. I watch you on PM Express fully. I know you never slept. Very obvious.
And you remember where I live, so I mean,
know,
it takes a whole day, a whole 24 hours to get back to
Okay, I think you have to stop making that excuse now. It's no excuse. You have no idea where some of us come from. So we don't want to hear that, please.
Well, I hold my horses on this one because I know where you live. It's I live in Timbuktu. You probably live in outer space. It's viewers don't want to know.
Both of you live in the eastern region. I keep saying, even though it's a.
I guess then let me go first. Let's start with the obvious story, the Martin Amidu story, which most of the papers do have. If you look at the graphic, I guess that was a headline that most people used yesterday in the broadcasting outlets. I mean, Amidu eligible as special prosecutor. The reason why I guess this story for me was a big deal. Either way, if he had gone if he had lost, it would have brought finality to a process that many thought had held him and prevented him from doing his job. I mean, now that he now has the all clear to go ahead, as a special prosecutor, I guess many people now will look, okay, so between now and the end of the year, what else can he do? You remember that the anti-corruption campaigners, one point, issued a statement quite concerned that a year on after he was appointed and his office was created, he had not done much. Those who sort of had sympathy for him pointed to this case and said, I mean, if you have such a big case, right, pending at the Supreme Court over your eligibility to hold that office, it will actually prevent you from doing your job. Because assuming that he had gone ahead and prosecuted somebody successfully and he had lost this case, what happens to all those cases that he has successfully prosecuted? Does it render all of them null and void? That was an open question. And so really, this is big deal for the office. Doesn't mean that now he can go ahead and prosecute all the people that, people saw he hadn't done over the last year. That's a big question for me, and I'm going to watch this space quite closely.
In fact,
all right. In my case, I didn't think that there should have been something that would hold or stop him from going ahead to prosecute any case. And I don't think he ever at any point stated or suggested that was one of the reasons why he couldn't prosecute any case. I guess I wouldn't take that as an excuse. He should have just gone ahead and did what he had to do. But, Joseph.
I know Joseph wants to say something, but, also to say that Professor Kweku Azar has been writing and also raising some very important questions. Maybe that's an area to watch. So, for instance, he says amending the mandatory retirement law to increase it to 70 while allowing people to voluntarily retire at 60 is something that we should look at. Joseph, what were you going to say on this?
And so Mr. Amidu never gave that court case as an excuse. He actually filed 2 cases against Mama Yarega, one related to the importation of ambulances for an assembly, and the other that has to do with the tax evasion issue. But there were a series of applications that the lawyers made in that particular case, and eventually Justice Efia Saribotri had to put the case on hold because the issue of whether Martin Amidu could prosecute, whether with a case pending at the Supreme Court, kept coming up. And so eventually she took the view that it's better that they put the case on hold pending that particular case being determined as well. And so after that decision was taken, there hasn't been any movement in terms of the case yet. And once this is out of the way, we expect that the Financial Division of the High Court will fix a date for that particular case relating to Mr. Yarega to continue.
Joseph, one of the things we said you would share with us and, of course, our viewers, how the court is functioning with COVID-19. Cameras are not allowed inside the courtroom, so paint the picture to us. How do they sit?
And so at the Supreme Court, the space, it's quite a relatively big space. There's downstairs, there's upstairs. And so what they are doing is that they are not allowing the legal teams in. And so if you're a lawyer, you have a case, you have to come in with just one junior. If there are two of you, one has to stay outside the courtroom. And even before you get into the courtroom, there is a Veronica bucket outside that you can wash your hand and use the sanitizer. At the entrance of the Supreme Court too, there is someone available with sanitizer who will give you the sanitizer and also open the door for you to get in. And so that is it by the way of the first part of it. Then inside the courtroom, where the lawyers sit, they try to separate them a bit. And so they don't sit too close to each other. They've removed some of the seats in order to create space. For the public gallery too, they've made some spaces, and so they are not sitting too close to each other. So if you are sitting on a seat, the next seat to you has to be empty, then someone sits after the empty seat. Then in terms of the Supreme Court judges too, one interesting thing to note is that there are seats which, for those who may have won the election petition, they are big seats. They've removed those big seats to the back, and they've rather brought relatively smaller ones, just to ensure that with the smaller ones, it's easier to space them out, because they have to sit on a platform where you have 7 of them and sometimes even 9, depending on the nature of the case. And so that is also being done. The only challenge I can say I noted is that when they change the panel, and so when a case involving a special prosecutor is called and 7 justices come, and they have to move out for the next 5 or next 7 to come, there's no disinfection of the tables and the seats. The same thing with the lawyers who move from the platform. When your case is called and you have to go up, they just come and resume the seat, and they have to be using the same microphones that you have to press to turn on that the others have also used. And so that is a bit of a challenge that some of the lawyers have even raised concerns with, that they expect some changes to be made. And so that is how it is working. At the High Court, to the similar approach at the High Court as well.
Interesting.
Can I make 2 quick points? I want to go to the Daily Guide front page, and it's the same story, but I like the fact that they linked the Supreme Court case with the Ayarega crying foul. And this is the story that an interview I did with him for PM Express yesterday, where, and honestly, when I was doing that interview, I had not thought about the case at the Supreme Court yet. But from what Joseph said, that case had impacted on the progress of the Ayarega case. I mean, but Ayarega in that interview had made really startling revelations about the family relations between himself and Martin Amidu, and how that prosecution, I mean, he's been prosecuted for the ambulance purchases and for the purchase of those vehicles, how he believes, and I think the most important point he makes there, how he believes that that case in court has very little to do with the actual law, but a lot to do with personal reasons, because they are family members, you know, not by blood, but by relations. And he gave some details about, you know, evidence that he's provided that hasn't been double checked yet. We'll see when this starts at the court, whether how the evidence he talks about plays out. But did anybody pay attention to Martin Amidu's daughter yesterday speaking for the first time, contradicting some of the things that Mahama Yarega said, that, you know, the children of Martin Amidu even sympathize with him against the dad? When he said it in the interview, I was a bit startled. And in the end, yet last night, the daughter comes out and says, that's not true. She's not even started in this car before, and I've never had a conversation with him about the case that the father is prosecuting him for.
Well, yeah, that was quite a revelation, because if you follow the interaction that you had with with Mahama Yaraga, you get to find that he seemed to have been speaking from a familiar position. And we all do know the relationship that he had. And that contradiction also speaks as to where the children of Martin Amidu, the special prosecutor, are gravitating towards. So they're gravitating towards more of their father than their relation. And I'm thinking perhaps maybe the Member of Parliament doesn't have a very good relationship with the children as well.
Well, if we can, I wanted us to move away and talk about another story, very heartbreaking if you're a parent or if you're simply a citizen of Ghana, and I'm sure all of you have been following. So I want to talk to the fathers first of all. This 26-year-old father who beat his 3-year-old, and it's incredible. How can anybody do that to a toddler? This is a 3-year-old child. It's also making the headlines. So guys, those who have children.
It's unimaginable. I mean, you wouldn't think that a father would do that to the child, let alone a 3-year-old. It's outrageous. But this guy says, well, a fit of rage came over him and he has mental issues and all. Could it be that could be the reason? But I wouldn't take that as an excuse, though, because the wife was also saying that she had endured, that such moments and such brutalities from the man. So I think the guy has a temper issue, and he seems to be taking it out on anybody at all. And I won't take any mental excuse. I won't take that mental excuse. It shouldn't happen. Never.
You guys have to forgive me. I didn't have the spine to listen to that story the whole of yesterday. I mean, if I was reading the news, I would have left that particular story to MFR and probably left. So I just couldn't. I didn't want to hear it. I mean, anytime I was listening to the midday news and it came immediately, start reading the story, I just sort of turned the volume down. I just didn't have the spine to listen. I mean, because I have children. And sometimes children do stuff that you want to punish, and that's typical Ghanaian parent. You have to know how to punish your child. I don't know, Israel and Mavi, whether you are like me. I mean, I don't spare the rod when I have to, but you have to do it reasonably within limits. You have to do it lovingly and let the child know that you're doing it because of what he's done. There must be a direct connection between what the child has done and the punishment, and that it has to be done for correction. I mean, not for distraction. I mean, for what you're seeing on television, that was clearly punishment meant to destroy. It's really tragic. I mean, never should it happen again. And I hope that the law will take its course.
Evans, are you saying that you would want to use a rod on your child?
No.
Okay.
No.
So what
no,
sort of?
Not at all.
Okay.
Not at all.
But I think that all of us over the last 20 years seem to have glossed over something that has been ongoing. Look, in 2013, I remember I had something to do with UNICEF, and they came out with a report which was indicating that 57% of children were beaten while at home, and it could be by parents, by their teachers, etc. And in excess of 30% of them received the same sort of punishment while in school. And it looks like because we've come to this day and age, especially in the cities of Accra, we have Kumasi and many others, thinking that, look, you don't have to spank or beat the children. We seem to have taken our eyes off the ball. And I think that is why people don't look out for some of these things. Because that, if you take what happens in the more developed countries, you spank your child, the police are at your doorstep. Here,
Roland, this is not a case of a child being spanked. This is to the extreme. This is more like torture. Okay? Yeah, you spank your child once in a while, every now and then, maybe you.
But that is unacceptable. Even spanking is unacceptable.
What is unacceptable? The spanking?
Yeah, even you using the word, it's unacceptable for us to say we spank our children. Unacceptable.
No.
I wanted us to...
They say spare the rod and spoil the child, and I very much believe
well, it's
in
good that you and I are not
right?
pastors.
I will go, to the extent of never. What this guy was doing was actually torturing the child, and to the extent that the child has to end up in hospital. Who's going to pay for the hospital bills?
Can we, I want us to look at another aspect of it, which perhaps going forward will be the most important. What kind of punishment this father would receive. Joseph Akable, you've been our court correspondent. You are our court correspondent. We've heard about how the child was kept away from the mother and the mother couldn't see the child for a while. There's also the abuse, there's also the harm. Can you, on top of your head, what will come against the father?
So we are looking at issues of battery, there are issues of assault, then there's obviously the bit about causing harm that we all can see. And so what we expect the police and the prosecutors for that matter to do is to immediately arrest him if they haven't already and try and carry out the investigation and process him for court. And more importantly, the bit about the mental capacity, whether he is sound or not, it's an important element that, if indeed there is scientific evidence to show that he's unsound, then obviously it's not a crime that he will have a bit of a defense in that regard, showing that he was not in the right frame of mind and couldn't have known what he was doing deliberately. And so it's important that they get that also out of the way immediately once they process him for court. And if he's actually sane, obviously we have to go ahead and deal with him in accordance with the law, because what has happened is quite unfortunate. And I struggle to look at the images myself, and I think he needs to be punished if he deliberately knew what he was doing and he did what he did.
Well, the good thing is police is on this case. They're waiting for the reports from the hospital, and then they will carry this case forward. In the meantime, the man, 26, has been arrested. In the absence of any other stories that you guys want to highlight, shall we do myjoyonline.com? Let's find out what's on our page.
In the absence of a story that should have been actually on the front pages, that wasn't on the front page. COVID-19 didn't make it to the front page again.
Yeah,
most
it's quite
of the
interesting.
Front pages.
There's a story on the front page of the
408 cases.
There's a story on the front page of the Daily Dispatch. I'm thinking that also leads to the bigger conversation I know we're going to have about the Electoral Commission. It's titled, Towards a New Voters Register, EC's tender for 1.9 million sterilized gloves and then reusable nose masks and hand sanitizers is ending tomorrow. And they put out a tender, and we all do know, we've seen that tender circulating on various discussion platforms that we have. And it points to a certain direction that the Electoral Commission says it's going. They are preparing these materials to make sure that personnel who will be employed for the registration exercise will indeed have them. And that registration is definitely coming off.
Well, the WHO has warned that coronavirus may never go away. We've got to live with it. Evans Mensah, you're head of our political desk. Politics must continue. Electoral Commission must do its work.
Absolutely. And the government was clear the last time that there's no other option other than holding elections on December 7th. And so that is going to happen. The question is the compilation of the voters register. Can we still have a credible, free and fair elections with the register that we already have, so that we don't have to do and compile a whole new voters register from the scratch? I guess for me, that's a big question going forward. The Electoral Commission seems to believe that you cannot have a free and fair elections with the current register. Many disagree with that, including the CDD. They believe what we can do, and which again the Constitution allows, is to simply clean the existing register, as in do a limited registration exercise and allow those who just turned 18 to register, and then do an exhibition exercise after that to take out ghost names, people who are dead, clean the voters register in essence, whilst after you've added on others, and then go ahead and use it for the 2020 elections. The elections will happen. Whether or not we should still do a voters register is one that we are still debating. And the Electoral Commission's position is absolutely clear.
Yeah, but is it with what Roland read, it means that they're going to go ahead?
Yeah, it's clear that they want to go ahead. What I'd like to add is, yes, the EC may want to conduct the registration, but are people willing and prepared to step out there?
Oh, they will.
Because, already people are concerned about COVID-19 and mixing with people and all that. So, yes, the EC may want to do that, but are people willing, and will that affect the numbers that are going to go out there to register? And then, for me, I'm also looking at the election itself. Are people, or will this COVID-19 impact turnout at the polls in December?
Well, I think that the political parties are even one of the main vehicles through which people tend to register. So you can bet that they will definitely bus people and find ways and means by which they can get members.
Again, if you're going to bus the people, social distancing, you can't pack so many people into a bus. So the busing is going to be even more expensive than it usually would be. So cost implications and all that, I think is going to impact the registration.
Well, Joseph, let's have you take us through myjoyonline.com real quick before we wrap up and make way for sports. So here's what's on the page, Joseph.
So the British newspapers report a former actor is wanted in Ghana over Airbus bribery scandal. I believe that's a story that we are quite familiar with. Amidu's verdict doesn't endorse extended retirement age for public office holders. That's according to the Deputy Attorney General. And also, drinking bars, nightclubs remain closed. That's coming from the Ministry of Tourism. There's a playback of PM Express. Very interesting discussion yesterday. Those who are watching could just click on that link and watch the perspectives that were shared on that particular platform. And SHS heads commend GES and Zoom Lion as disinfection exercise, which is Bono region.
I mean, can I say something about this COVID-19 with the Ghana tourism thing? It's the way the communication has been handled. It's a total mess. I mean, you see the Ghana Tourism Authority issue a statement hours before that, all clear, bars, drinking spots, etc. On a lighter note, the Drunkers Association guy was on Newsline saying that the minute he heard it, he had gone to take his akpatashi and he's enjoying himself. And then minutes later, I see the tourism ministry says, "Oh no, that's not what is going to happen."
Hold on.
I mean, what is this?
Yeah, it's a total mess.
We need at this time.
And it's a total mess. And I have to say that kudos to the government COVID team for the way they've been briefing us. And I've always held this position that what is communicated at the top is not followed through by way of what needs to be done in the communities. And it's really the sort of miscommunication that seemed to be ongoing in relation to how we're managing this COVID. Because we're saying people should wear masks, etc. at the top, and it's not happening down. And it's the same thing. People will go back to the drinking bars, etc., and the infections continue.
Easy, you've got 30 seconds to comment on it. Same with you, Joseph, before we go.
Well, I would have wanted to give that to you, Mama V, because I'm told that there's some gap in the law which allows the drinking bars to operate.
Well, I'm not sure. Joseph can help us because the president was clear with the drinking bars. Was one of the the mentions in that EI.
The president was clear, but apparently in the law. Joseph.
Yes, and so what is a bit confusing, even beyond the bit about this two things, I wonder why this directive, if it was even supposed to be implemented, didn't come directly from the presidency, and it has to take the tourism authority, especially when the president had clearly announced that this was still in force, and the tourism authority came out to speak on this particular matter. The other issue that some lawyers are also raising is to whether the ministry can overturn the decision of an authority. When it used to be an agency under the ministry, but this time around it's an authority following the changes they made. And so all these are issues that we understand that the Ministry of Information, the press conference will be having in a few minutes' time this morning, will be addressing those concerns.
But we do know that the authorities operate with the ministry having oversight, I think.
In the meantime, the Tourism Authority has actually issued a statement to these outfits, to the hotels, at least I know. So how confusing this whole thing will play out, we'll see. But thank you, gentlemen, for helping us with the review, really.
You're welcome.
All right.
Thank you.
And you have a good day.
Enjoy working from home, Easy. I envy you. The rest of you see it on the other side.
sometimes it gets boring, you know. I mean, sometimes I want to come to the office and look at you.
Oh gosh.
Israelite.
Didn't see that coming.
Israelite.
Enjoy the rest of the day, guys.
Bobby, that's Bobby line.
All right, we've got sports coming your way.
Have a good day, all of you.
Benedict is up next. Stay with us.
Welcome to the sports segment here on the AM Show. I'm Benedict Osu. In our very first story this morning, the communications director at the Sports Ministry, Kofi Asare-Brako, admits they owe former Black Stars coach Kwesi Appiah and are keen on paying him. Now, the ministry and the FA must cough $185,000 for Appiah, whose contract was not renewed after last December. Well, there's more in the following report.
The nation has done Kwesi Appiah a lot of good. Now, let me come here. You know, for close to about 24 months, we've been constantly paying Kwesi Appiah for 24 months. His contract would have expired in April last year. April last year. But at the time, we were going to the Nations Cup. So ideally, any person in power at the time, at the FA, could have said that, okay, let me give you 3 months extension. Okay. That could have expired maybe after July, when the tournament is over. And if you're able to win the cup for Ghana, you are kept as the head coach. If you fail, then because there was a clause in the decision that you have to go and win the Nations Cup, you couldn't win. So it is up to those in power to say that you couldn't win. So we are parting ways with you. But in the circumstance, the contract was extended to December. And just believe that after the Nations Cup in July, we were even booted out, so we would not even sit there till July ending. So what it means is that we have to pay him from that time until December, where there were no active, football. But so we have accepted that we'll pay.
Corona is not killing Ghanaians, and it will not kill any Ghanaian. Why? Because they be amunum soboro. Miwa hibiscus. You're always drinking hibiscus flowers. That's soboro. Miwa ginger baby amudi, garlic baby amudi. Corona be any attack him. Pepper baby amudi amudi. Corona be any attack him.
That's 24-year-old Bless Ahmededbe making claims in a recorded video of himself inciting the public to defy the stay-home presidential directive aimed at halting the spread of coronavirus in Ghana. In the said video, which was made during Ghana's 3-week lockdown period, Bless claimed the directive to stay at home was a hoax and he planned to install 5G cables in the affected areas. Those 5G cables, he claimed, were meant to kill Ghanaians.
Tokro na ye tutu eden tokro. Wa dwe ka cho say e pipeline ni show wa be fe mu bua. E 5G network. Unwa de na e 4, baku 4 say. E na mo di shemu me bua. So that is 5G network. Enu e na e ku nkrofo no corona nko obi a.
Bless Ahmededbe was also seen in the video inciting the public to rise up against national authority.
Munjin Ghana for munjin. Me see, muntisi krom, mu amuodro, munkoji edo no nhye police ni buwa bonfi otuwetu adoje no na bumi na kuno because Nana Akufo-Addo onim de oye obeso okuye nyina ye mani nyina bewu mun bie mu enim 5G no eno na Akufo China eno na Akufo America.
The claims Bless make in this video are untrue. Ghana Health Service statistics show coronavirus has killed 24 Ghanaians. It has been scientifically proven that 5,408 have been infected so far. Statistics from several sources, including the World Health Organization, show that coronavirus has killed 297,003 people across the world. The actions he's inciting people to take are also criminal. All over the world, it is not uncommon to see such videos largely full of untruths and misinformation with the potential of swaying minds and impacting behaviors negatively. Well, whilst many feel invincible on social media, Bless was struck down by the national security operatives who came across the video. He was arrested on Tuesday, charged with false communication and assault on public officer contrary to Electronic Communications and Criminal and Other Offences Act. He was put before the Accra Circuit Court 4 and remanded. Bless Ahmededbe has been explaining his actions after his remand. He claims the video was meant for a skit on his personal YouTube channel but went viral.
The motive behind the video actually because that is not even the video I was coming to do, but that is the acting part of it. What is on the net. So I just tried to let them go off it, like that is not the right way, but I have to do it in a funny way. That was my motive, because I just want my channel to also blow. I pick all those informations so that after doing the first video, which is out right now, after doing it, then I'll now edit, just like how Teacher Kojo does this one. It is something new that I'm doing. The channel is even new. My channel is a new channel. I don't have subscribers. So that was what I did. Because even on my channel, I know it will never go viral, because it's a new channel, no subscribers. I don't have likes. The highest I had was 4.
The Mamobi-based private security guard says he regrets his action and has an advice for people who spread fake news and misinformation, especially in these times of global health crisis.
The only thing I'll tell anybody who wants to, first of all, venture into YouTube and all those things, right now, what I regret is what I used to advise. I get it. I wish I had waited to get enough money to get all the assets I needed. But I did a mistake. That's why the whole editing was not out before the video itself is going. That's my mistake. That was a silly thing I did, and I regret it so much. I wish the video never went viral.
The court presided over by His Honor M.E. Isando has adjourned the case to 22nd of May 2020. On that day, Bless Amedebe will know his fate, but he will spend the next 9 days and nights behind bars, and no one knows whether the court's decision will keep him there any longer. The claims Bless makes are untrue, and it took a simple click of buttons on his phone. But remember, a click on your mobile phone to spread false news can always be avoided, and so will time behind bars. The WHO says the world is not only fighting a pandemic, but infodemic, which can equally be fatal. Do not be the one to spread misinformation. Most importantly, do not feel invincible. If you spread fake news, you can be tracked down.
Well, that's today's episode of Joy News' series titled Combating Fake News. I hope that you've learned the lesson. You can become popular through other means, but certainly not passing on false information. You could be in trouble. Well, the World Health Organization has warned against trying to predict when the virus would disappear. In fact, it says the virus may never go away, so we've got to live with it. I want to paint the picture with you in Ghana in terms of the case that we've recorded. Here we go. We've got 5,408 confirmed cases, and this is confirmed by the Ghana Health Service. We have 514 recoveries and sadly 24 deaths. Well, because of COVID-19, also sexual and reproductive health services are not being patronized, not because the hospitals are shut, but for some reason, some people are simply not showing up, either for immunization services, antenatal, generally sexual and reproductive health services. So we've got a family health doctor joining us. She's actually the acting director, Family Health Division of the Ghana Health Service. Dr. Isabella Sego Moses is on call this morning on the AM show. She's going to help us appreciate how widely spread this is in the entire country, but also help with your questions. If you're pregnant and you're not going for antenatal, why? If you're not sending your child for that immunization, why? What are you so afraid of? That's why you're not going to the hospitals. Dr. Isabella Sego Moses is joining us via Zoom. Let me say good morning to you, ma'am, if you can hear me.
Good morning. Yes, I can hear you.
Okay, great. Thank you for being our doctor on call this morning. So help us, first of all, appreciate what this issue is and why the Ghana Health Service is worried.
All right. So this issue is something that has been noticed in other parts of the world. Whenever there is a pandemic, it turns out that all attention is focused on curbing the pandemic, and somehow routine services tend to suffer. And that has been reported in the case of the countries that had Ebola, like Liberia and Sierra Leone and other parts. and during other pandemics as well. So unfortunately, we are observing the same trend in Ghana. We are noticing that our routine services like antenatal care and child health welfare clinics are not being patronized as much as before. And that is a source of concern for us.
In terms of the data that you have, when you visit?
Yes, in terms of the data that we have, for the first quarter, for example, we compared our figures for this year, first quarter, with figures that we were seeing in 2019 and 2018. And the number of women coming to antenatal, the number of children being brought to child welfare and postnatal clinics are all reduced for the first quarter comparing to the previous 2 years. And if I may be more specific, if we look at our immunization services, we looked at comparing this year's first quarter to last year, and we realized that the total number of children that were being immunized has fallen, such that the unvaccinated children that we recorded for the first quarter is almost 33,000. So it means that we are not reaching them. They are not coming for their immunizations. And this is very worrying because then children will be at higher risk of contracting these other vaccine-preventable diseases.
Is it because we don't have the vaccines?
No. Fortunately, we have the vaccines, we have all the logistics. It is because there's this fear and panic about accessing health services. Our clients think that if they come to the health facility or they come anywhere near health providers, then they will be exposed to contracting COVID. And so they tend to stay away. I must admit that in the beginning, some of the health workers were also apprehensive, but that situation is changing now that the protective equipment is becoming a bit more available. So these are the main reasons. People fear that they would catch the COVID when they come near us. So I have had calls from some mothers who have expressed the concern that it's time for their children to be immunized, or they have to go to antenatal, but they are scared, so they are not going.
And this 33,000 unvaccinated, because we know that the vaccinations are also time-bound. So if you have to go for 6 weeks and you miss it, it's got implications.
Yes, it's got implications, but it can be remedied within some few weeks. If you still attend and you are given the next dose, it will still work. So that is what we are focusing on now, trying to heighten awareness among our clients to access these services, to tell them that it is safe to come. We are doing all we can to protect them. And the children still need to be protected against measles, against polio, against hepatitis B, and all the 13 conditions that we immunize them against. For the antenatal women too, they still need to come to have their blood medicines, to have their blood pressure checked, to have their anti-malarials. This will ensure that their pregnancies are safe and the deliveries are also safe.
And I also wanted to ask, could it be that maybe some parents have been to these facilities and because of what they've witnessed, they haven't shown up the next time?
I won't rule out that possibility. And that is why, in trying to remedy the situation, we've done some housekeeping. We have talked to our health workers and we are making provision. So A directive has gone out from the Ghana Health Service Director General. We provided a set of guidelines stating that every vaccination or antenatal clinic should observe all the recommendations for preventing infections. So they are all providing hand washing facilities for the clients. They are all screening the clients before they are admitted into the clinic. So if anyone is found to be a suspected case of COVID, then they are not allowed to mix with everybody else. They are straight away handed over to the team that will now do the necessary testing and so on. And we are also ensuring that our health workers are also properly garbed. They have their mask on, and the clients also have their masks on, and the health workers have gloves on and change them or wash their hands frequently.
Let's talk about family planning, and if the picture you paint for the immunization is same, then we should be worried that unintended pregnancies may spike.
Unfortunately, the picture is the same, and that exactly is our worry, what you stated, especially when couples are spending more time at home now. We are worried that unintended pregnancies may arise, and with that also abortions, illegal abortions and unsafe abortions. So our messaging to health workers and the strategies that we've put in place also cover family planning.
Is the same reasons that you're picking up from the ground? And if you've got data to help us appreciate how badly the situation is in terms of the comparison from the previous year and this year, the first quarter at least?
Okay, so let me do antenatal registrants.
Okay.
In 2018, we registered 2,000, I'll round the figures up for ease of understanding. So in 2018, we registered close to 242,000 women at the antenatal clinic. In 2019, we registered almost the same. But in 2020, first quarter, we only registered 2,336,000. So that's for antenatal clinic. And then when we come to, just a minute, child welfare clinics, in 2018, we registered we registered about 4 million children at the child welfare clinics. 2019, a little more than that, about 4.1 million, but 2020 it's come down to 39, 3 million.
Okay,
so
and this is as at what time? This is as at what time this year?
This is first quarter, as at March ending. Yes.
Okay.
So that is the situation. And we are seeing that in almost all the regions, the drops in the registration.
Okay. Which of the regions would you say will be recording the highest figures?
The highest, like those that are having most people attending.
The lowest patronage, exactly.
Oh, lowest patronage. I don't have that readily at hand, but we do know that Greater Accra, I talked about unvaccinated children earlier, where I said 33,000 had been left unvaccinated. Greater Accra alone had 12,000 children left unvaccinated. And I am not surprised because it is Greater Accra and Ashanti that we had the lockdown. So the lockdown also had played a role. I mean, apart from all the fear, the lockdown also rendered clients, they didn't know whether they could go out safely within that period. So that also made the situation worse.
Well, we will talk about how do we change this? How do we change people's minds? What do we tell them so they are not afraid, and then they can go out there and visit the health centers? But let me invite our viewers to join us with their questions. If you're pregnant and you're not visiting the hospital, why not? What's your fear, really? If you're not sending your child out there, why not? Give us a call on 0302-211-69-102. 0302-211-69-102. Alternatively, you can also send us some WhatsApp messages. My guest is Dr. Isabella Sego-Moses. She's Acting Director, Family Health Division, Ghana Health Service. She's going to take your questions, and hopefully, you know, we can make it a lot more easier. We can put some kind of confidence in you so that you can wake up and visit the health facilities. Dr. Sego-Moses, you know, initially we said if you're feeling sick, stay at home, call the emergency numbers. Even though we've lifted, we're no longer under lockdown, we still can go out there and still do our business, except that you have to follow the protocols. You must wear your face mask, you must social distance. But we are also saying, if you can, stay at home. That stay at home message is still very much on. Could it be the reason people are not confident enough to step out?
It's a possibility. So even when we said stay at home, we did say that unless you have to go for essential, you have to go out for some essential reason. And perhaps we should make it clear that if you are going to access health services, preventive health services, antenatal, postnatal, child welfare, these are essential reasons for going out. So we shouldn't stay away, because staying away from these clinics is rather put us into more danger in trying to prevent ourselves or protect ourselves from COVID infection. We might end up with other health conditions that we could have easily avoided.
Let's go onto the phone lines. Kukwa is in Tema. She's joined us. Good morning, Kukwa.
Good morning, Amazing.
I hope you're well.
I'm great.
Okay. Great, we thank God. Is it a question or a comment?
A comment and a question too.
Okay. All right, please go ahead.
Well, my comment is I have a 9-month baby.
Okay, Kukwa.
Yeah, I have a 9-month-old baby. Well, on his 8th month, I was supposed to go for weighing, but because of the lockdown and all these things, part of me was afraid, so I didn't go. But this month, he turned 9 months. We were supposed to go for our vaccination and stuff. We went there, and they told me they are not doing weighing, and the vaccine too is finished. And they took my number that they would call me. So I had a friend who's a nurse, so I called to check up, and he was like, oh, yes, they have the measles, but the yellow fever, they don't have it. And she would get back to me when she hear anything. So it's not that we are not going. We are going, but yes, we are afraid at the same time. But like I said, I went there, they said they don't have it. So me going back there, I'm a little worried, and at the same time, I need that vaccine for my baby, because 9 months, I don't know if after 9 months, whether, I mean, he can still take the vaccine.
Okay, so which facility specifically, Kukwa?
I went to the Sakumono.
Okay.
Sakumono, yes.
So they haven't called you back?
No, please.
Okay. Let's put that question to Doc. Doc, I'm sure you heard Kukwa.
Yes, I did.
Okay.
This is unfortunate. As I said in the beginning, we were all, you know, the health workers as well, we were all caught up with COVID activities. And the shortage of the vaccine that she's talking about must be a localized one for that clinic. It's not a shortage. We don't have shortages nationwide. Even after 9 months, Kukwa, you can still take your baby. It's okay to vaccinate, and it will still work. We'll check up on this facility, but you are also free to, if you know any other vaccination site close to you, you can go and your child will be vaccinated, even if that's not your regular point of attendance. Especially because this week is our Child Health Promotion Week, and we are upping our activities for immunization, vitamin A, and all the child welfare services. So it's very likely that even in Sakumono, where they said they didn't have the vaccine before, it's more likely they will have it.
Okay, but should she be worried considering...
After this program, I'm going to call and try to address that.
Okay, great. But should she be worried because this is the mother who was due to get the vaccination and it didn't happen? Of course, she'll have a few things on her mind.
No, don't be worried. Just try and get it as soon as possible. There is some leeway, even if you miss your scheduled date.
Okay.
It's still okay to go.
All right. Let's talk to Al Hassan. Al Hassan is in Teshi. Good morning to you, sir. Thank you for calling.
Good morning.
Yes, sir. Let's hear you.
Please, my question is about this weighing. Because my wife went to a Lakeman hospital, Fibro, and she was told that once it's not coming for injection, they are not going to treat her. She has to go back. They are treating those who are coming for injection. So I wanted to find out whether it's true or this.
Okay, so Al Hassan, how long ago was this?
Last month or so.
Last month. Okay, so
Yes.
so the child was just going for the regular weighing, not to take injection.
Yeah.
Okay, all right. We'll put that question to Doc. She'll address it. Let's talk to Majid. Majid is in Tamale. Good morning, Majid.
Yeah, good morning.
Yes, Majid, thanks for calling. Let's hear you.
Yeah, having my wife, she's having 6 months pregnancy, and she's going for Tamale TPH for regular
antenatal.
So when this COVID-19 came, they told them that they shouldn't come again. They closed it. So as of now, from March up to date, they haven't gone to antenatal.
So even in the month of May,
they are not doing it.
Even in the month of May, they said they are not providing such services?
Yeah.
Okay,
yeah,
and this is Tamale Teaching Hospital.
Yeah.
Okay.
Yeah.
All right. All right. So, well, thank you for telling us about it. We'll let Dr. Sego address that. Solomon is in Asofa. Hello, Solomon.
Yeah. Hello.
Is it Asofa or Asofa?
ASOFAN.
Oh, okay. All right. Sure. Let's hear you. Hello, Solomon.
Yeah, it's Asofa. ASOFAN.
Okay, I get it. You're on air, so let's hear your question or your comments.
Okay, about what the woman was saying. Yeah, the same issue the woman was saying, complaining from Tema.
When you say the same issue, you went to a facility and they say they didn't have the vaccines?
Yes, please. We went to Kolebu.
How long ago was this?
Don't have the yellow fever.
Yellow fever. Okay. How long ago was this?
Well, it was right after the lockdown.
Okay, so this will be in April.
The Monday after the lockdown.
The Monday after, and you haven't gone back since.
No.
Okay, so the child.
We are giving the measles, but not the yellow fever.
So the child hasn't still taken the fever vaccine.
Yes.
Okay. All right. Let's talk to Yusuf from Cape Coast, and I'll let Dr. Sego address the issues that have come up. Yusuf, good morning.
Yeah, good morning.
Good morning, Yusuf. Thank you for calling. Let's hear you.
Yeah, okay. Please, what I want to find out is children of, let's say, about 2 weeks old, are they supposed to take any vaccine? Because my wife went to the hospital when my child is 2 weeks old, and she was told that if the child is okay, she should go back home.
Okay, but the child got the initial, you know, when the baby is fresh, you also receive something.
Okay, when the baby is fresh, I know the baby received something, but then I don't know if the baby actually got some vaccines when he was fresh. But then I'm sure that thing will be done. But later on, after 2 weeks.
Okay, so which hospital specifically are we talking about, Yusuf? Hello, Yusuf, I'm losing you.
Yeah, I said Cape Coast Teaching Hospital.
Cape Coast Teaching Hospital. And how long ago?
That was last week.
Last week. All right. Doc?
Yes. Thank you. I am very happy that we are getting, this feedback from the ground. So there was one question about weighing at LECMA and the mother being told to come back when the child is due for vaccination. One of the strategies that we have talked about to reduce contact is to try and focus on the very essential visits. So if the child goes when they are due for an immunization, then the necessary things would be done. And for now, it's not really necessary to go for all the, series of visits. We want to maximize the visits so that we reduce the time that they are in the hospital. Then Majid about the 6 month.
This is the Tamale. This is
the woman
6 month pregnancy.
His wife who is 6 months pregnant and went to Tamale Teaching Hospital. I think that a number of these things occurred at the beginning, especially during the lockdown, when we ourselves were overwhelmed and some of the staff were drawn into the COVID prevention activities. But that has been rectified. And we are sending out messages. We've been sending out messages to the communities that they should come. So please let the woman go back for her antenatal clinic. And then Solomon talked about also yellow fever, similar to the Sakumono situation. I would advise again that we go back to the health facility. But from here, I'm also going to find out about the yellow fever situation. But as I said earlier, I'm not aware of any shortages in vaccine. So it may be a local situation that should have been rectified by now. For Yusuf, a child who is 2 weeks, as was rightly mentioned, at birth, the children are given BCG immunization against TB, and they are also given their first dose of polio immunization. So it's possible that the child has had these at birth, and the evidence will be in their child health, maternal and child health record book. So Yusuf, you can check that. And that may be why they said they don't need any vaccine. But if they've not been given at birth, then they can go back and have it given now.
But
so after the vaccination at birth, we don't give them any other vaccine till they are 6 weeks. So the 2 weeks check is just for postnatal to see if the mother and baby are well.
Okay. Doc, on Majid's issue, because he did say that they're not providing antenatal services, is this something that you're aware of, or you think it was only because of the lockdown?
Yeah, I think probably it was the lockdown and some other issue local at Tamale. We are providing antenatal care for pregnant women. It's very, very important.
But if he goes and the situation is still the same, what then can he do?
As I said, after this program, I'm taking note of all the comments that are coming.
Okay.
And I'm going to touch base with the various regions and facilities.
Okay. All right. You can give us, if you have concerns, if you've got a question, kindly call us 030221169102. I have some messages I'll be sharing. By Yusuf, you called from Cape Coast. Please take the weigh-in card and check if they have records of any vaccinations they may have given you when the child was born. Check, and then you can give us a call back before we wrap up. Even if we've wrapped up, kindly call back and give us that feedback. It's really important. So check the weigh-in card and let us know. But I'm impressed because we've gotten a lot of calls from men. It means that you're involved in the process, which is very impressive. Richard is from Choco. Good morning, Richard.
Good morning, Madam, and how are you doing?
I am very well, thank you. Thanks for asking.
Yes,
Yes, Richard, you're on air.
Yes, from doctor's submission, I realized that they had the information from the post-pandemic. We had so far information on what the occurrences has been like. I want to find out from her, based on her submission, she has the data of how the trend is like in different countries, even with Ebola from Liberia and all those places. And I want to find out from her, as she has those data, why has she and her colleagues and her department sat down the moment we had a lockdown, put structures in place. From the people, those people that have called so far, they have challenges accessing the healthcare, right? I believe now she's going to get those people in the what she doesn't know about the local shortage or something like those things. I believe in her department, they have to put all those structures in place before even the lockdown.
Okay.
And then from the guy that called from Tamale, the wife went there and they have to return the wife back to the house. All those things would deter even the patient going to the healthcare facility to assess it.
All right. Well, thank you for the feedback, the observation. Well noted. We'll get Dr. Sego to comment on that. Dennis is in Dansuman. Good morning, Dennis.
Good morning, Mama. How are you?
Very well, thank you. How are you?
I'm blessed. I'm
great.
So,
thank God. Let's hear you.
Okay, Mama, I have a question similar to one of the earlier callers. And this time around, my child is close to 3 months and now he's 6 months. You know, we've been attending the antenatal, should I say antenatal or how do you call it? Is it antenatal?
No, I think antenatal is when you're pregnant, isn't it? Okay, so this is the weigh-in. This is the...
Okay, yeah. So my wife has been attending the weigh-in before the lockdown. And then she decided to pause due to this COVID-19 issue. She's not been going for some time now, and the child is due for the 6-month immunization. But with the current number that we are experiencing, I want to find out, is it advisable that she go, because she's been attending it at La Paz, or she can get to the nearest hospital or healthcare facility so that she'll be immunized? That is what I want to find out.
Okay, so where do you live?
I live at Dansuman.
So that's where your wife is as well?
Yes.
Okay. I think the advisable thing is to find a facility in Dansuman to attend to, but I am not the expert, so we'll let Dr. Sego comment on that. Okay?
Okay.
All right.
Question is, I want to find out that if for any other reason she decided not to go for the immunization, would there be any effect on the child?
Okay. This is 6 months, you said?
Yes.
Okay. All right, sure.
Okay,
thank you. Yusuf from Cape Coast, you have the feedback. You've joined us again.
Yes,
Yusuf? Okay, let's hear you. So you have the weigh-in card?
Yeah, at the moment I'm not in the house, so I called the mother.
Okay.
To find out, and she told me at first the child was given injections.
Okay.
So it's confirmed for the doctor has said.
Okay. All right.
All right.
Okay,
all right.
then.
Thank you very much.
Well, you're welcome. I am glad that we've been helpful to you. Yusuf there with that feedback. Doc, there was a comment, observation, feedback from Richard from Choco, and then Dennis in Dansuman with that concern. If a child is 6 months, can they miss the vaccination?
My advice to our caller from Dansuman, please, as much as possible, try not to miss the vaccination. Because every time they attend, we have specific vaccines that they are given. And they are given vaccinations against 13 different conditions. So if you miss one and you don't go at all, you don't know when that the child will be exposed to that particular condition. And if they are not covered at that time, then they are likely to succumb to it. However, if you have missed and you know, it's not too late. As was said, you can attend the nearest, your wife can attend the nearest facility in Dansoman, and they just take the card, they would look at the records and then continue from where they left off and give them the ones that they have missed as well. There was a comment from Richard. Richard, let me assure you that we are not just now waking up and saying that this is the situation. We have been studying what is happening on the ground. We have put down together some guidelines. We have engaged all the regions, and the regions are also engaging the downstream districts and health facilities. It is true that in the initial stages, like the rest of the country, we were all overwhelmed, and every concern was about stopping the COVID. So some of the vaccination staff had to assist with contact tracing and stuff like that because they know the communities well. Now we are back. We have put in measures and we are doing massive health promotion. We are also currently this week marking Child Health Promotion Week. We are sending out messages all over to try and pick up the pieces. So maybe we could have done it earlier, but let me assure you that we have not just been resting on our oars. We've been studying the situation and putting things in place.
All right. Here's a message from Ben. Ben is in Brekum. Ben says, I took my son for weighing and I was sent back with the reason that the child has to be undressed, which wasn't safe because of COVID-19. I was asked to come back when the COVID is reduced, gone down. Would get Doc to address that. But Obed is at 37 and he's joining us via phone. Obed, good morning. Thank you for calling.
Good morning. Thank you once again.
All right, great. Let's hear you.
Yeah, mine was not really after birth, but during like antenatal. Yeah, I and my wife actually attend our antenatal at Tema General. And one thing I want to say is we have to thank the Tema General Hospital because their midwife are still taking care of us even whilst we are not visiting the premises because of COVID. One of our midwife, Man Lizzie, I don't know the full name, Man Lizzie, actually responds to our call day in, day out to check on our. Well, now my wife is faring, and now best we could receive treatment.
Okay.
So,
are there particular names that you have?
Okay. Unfortunately, I don't have the name of it, but I know Man Lizzie. I think room 5 or room 6 at Tema General Hospital.
Okay, all right. Well, thank you for appreciating the services that you've rendered. Obed from 37. Let's talk to Joseph. Joseph is in Seshri, Janase. Joseph, you're on air. Good morning.
Yeah, good morning.
Yes, sir. Let's hear you.
Okay, my issue is I went to Seshri Regional Hospital yesterday.
Okay.
And a friend of mine was feeling very sick and hot, but they just gave him malaria tablets. Actually, there was no testing whatsoever, and they said I should take her back home. So I was a little bit concerned. So she was very, 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 very hot in the morning, and so I was wondering whether, I don't know the process. I don't know what actually they do when it comes to COVID-19. Whether when you're feeling very hot, you don't need any testing or something.
So was this a child or this is an adult?
It's an adult.
Okay, and you said that the person was feeling hot.
Very, very hot.
And all they did was?
All they did was they asked her how she was feeling, and the doctor perceived malaria and prescribed malaria drugs for her.
Okay, so no laboratory tests?
No laboratory tests.
But are you familiar with the symptoms of COVID? Are you familiar with the symptoms of COVID?
Yeah, I'm very familiar with the symptoms of COVID.
Okay, did your friend experience anything apart from you said the temperature? Apart from that, was there anything close to the symptoms that you've had?
Yeah, it's only the temperature.
Okay. Well, is there a second facility you can visit?
Yeah, there's a second facility.
Why don't you try that?
Okay, and there's one thing too I wanted. It's not related to the healthcare services, but I just wanted to draw attention.
Okay.
Concerning the public gambling places. It's like during this COVID-19 pandemic, nothing has been addressed concerning those places, and people are trooping in there. I don't know whether you people follow it up.
So
like
this is the betting outlets.
Pardon me?
The betting, you mean?
Yeah,
okay.
The betting outlets.
Okay.
They are still in operation, and a lot of people are there 24/7.
Okay.
And so
I'm wondering, is there a specific community where you've witnessed this?
In fact, I've been in Kumasi.
Okay.
It's on. I've been in Sefi here. It's still on.
Oh, okay. That was really important message that you were passing on, but I guess that we get it. Thank you. We'll try and do the follow-ups with our colleagues in the region. Let's take some Facebook messages. We'll let Doc address the concerns that have come through via phone. But here we go with the comments on Facebook as well on the same subject. Question is, are you afraid to seek medical care at the hospital during the COVID-19 era? Share your thoughts with us here and also via WhatsApp number. And here are the responses. Stevens says, in Ho, there's no fear. Face masks have been sold exactly at the hospital's entry point. Without it, you will not be allowed to enter. Hand washing facilities have also been provided at vantage points in the hospital. All right, that's very good news, Stevens. Thank you for sharing the whole experience with us. Ken says, yes, I'm afraid because slightly rise in temperature nowadays mean you have COVID-19. What about first when COVID-19 was not reported? Then we have high temperature, body temperature. All right, Ken, on the general COVID situation and how we're all feeling when you're down with any tiny thing. Prince says, yes, last I went to New Regional Hospital with my patients and I saw the health workers, they're treating patients at the emergency ward without hand gloves. This means that the likelihood of them contracting the virus is high and transmissions to other innocent patients also very high. So sharing an observation with us, Prince Prelix Holiness. Any other more comments? So here's Churches. Okay, having flu for the past 2 days. Anytime I'm sick, is this kind of flu? But now, dear, I'm afraid to attend hospital with this. Okay, so Churches having some flu and not wanting to go to the hospital because of fear. Angel Michael says, yes, because now the moment you get to the hospital, if your body temperature rises, PET automatically will be attributed to COVID-19. So due to some of these things, some of us do not trust some health workers. All right, Angel Michael there. Whilst we wait for more comments, all right, this one's from Empress Mawenya. Empress says, I needed to go for a routine checkup at Rich Hospital on March 22nd. Fear of catching the virus there stopped me from going. So you haven't been to the hospital to check. Professor Einstein Senior says, on 12th of April, I once visited a hospital, but the way the doctor looked at me, my face after checking my temperature, I got a little scared. So okay, so you took some paracetamol before going there so that your temperature will not increase again. All right. Ajua Ohenewa says, yes, afraid of contracting due to touching shelves, sharing seats with others, and many more. Had to bath 1 full bottle of sanitizer the last time I visited. That's scary, Ajua. Emmanuel says, I'm much afraid because I lost trust in human beings. You might never know the agenda behind COVID-19. All right, Emmanuel there. Okay, John says, I can't even go to the hospital because I'm scared of being isolated. The stigma alone will kill me early. John, you didn't indicate what is going on with you. I guess from what you have shared, you're experiencing something. You're definitely feeling something, but you simply don't want to show up in the facility. Bayer Jeremiah says, more than the word afraid, the increasing rate of the virus is scary and worrying. I witnessed some people's cough, and I swear never to step at the hospital in this COVID-19 era. The dangerous aspect of it is that people don't take precautionary measures seriously, even at the health facilities. All right, so lots of feedback on why people are afraid to go out there to the hospital. This one says, at birth, my boy was given BCG, but there is no scaring on the... Can I go for a second vaccination? Mary from Wa, I'm not sure I quite understand some aspects of your message, but you're asking, I guess, the latter parts, if you can go for a second vaccination. So that's a what situation. Doc, let me allow you to comment on some of the issues that have come up with the telephone calls and also with the Facebook messages.
Yes. All right. So I think the first caller in this section talked about the child being taken to the child welfare clinic and being told to go back because they have to undress and so on. I think it's a similar situation to what we addressed earlier, that if the child is just going for weighing, they might probably say, come back when they need vaccination, so that we give that essential service. They wanted the weighing to wait. We had Obed being happy with what he experienced at Tema General. And I'm happy to hear that, because one of the measures that we have recommended to our staff is to share their contact numbers with their clients for antenatal and child welfare clinics, so that they can reach them at any time if they have questions. So I'm happy to hear that Tema General is doing that. And I know that other facilities are doing the same. I think the rest of the comments were mainly about the fear in everybody to attend the hospital, to attend to the clinic for any reason.
Yeah, Doc, can I ask you to hold on with the comments on that, because I want it to be the last thing that we address. So let me take some messages on the WhatsApp. Okay, so this one says, are you aware that hospitals are attending to only 45 patients in 24 hours? Gas South Hospital, morning doctor attend to 15 patients. Same applied to the afternoon and evening doctors. This is Eddie in Oglogo. My child temperature as at the time I reported that the hospital was 39 degrees. They turned me back with information that the morning doctor had attended to 15 patients. Doc, are you aware of this situation? And he cites Gas South Hospital.
No, I am not aware. We have not given a limit, of patients to be seen a day. So if this is happening, it shouldn't be happening, and we will follow up on that.
Okay. This is Mavi from Takwa says, Wayne, it's full. Oh, so the full name is Child Welfare Clinic. All right, I guess this is a nurse telling me about it, because we're struggling. We know antenatal, but the weigh-in, we just say weigh-in. So Child Welfare Clinic, thank you very much.
Clinic, yes. Or CWC.
Yes, absolutely, thank you. This one says, my son was 5 years last year. However, his last vitamin A vaccine were not given, just that we came late. Nicholas in Ho. Vitamin A, Doc, should not be so worrying if you miss it.
Vitamin A is also important, especially because vitamin A boosts immunity. Vitamin A boosts immunity, and this is the time when we need our immunity to be up there. So children start being given vitamin A from 6 months, and they are given every 6 months till they are 5. So, but it's okay. If he's now more than 5 years old, we should look at the diet and make sure that he's having the fruits and vegetables, and then he will have his vitamin A and other vitamin sources from his food.
There's a technical question, I guess only you could understand. Says, what's the doctor's advice to all G6DP food defects in this COVID-19 crisis. Has it got to do with children?
Yes, G6PD is one of the conditions of the blood. It's an enzyme defect. Some have a full defect, some have a partial defect. And so when you have it, you cannot take certain medicines and even some foods. And once it's detected, the parents are given the full list of drugs that should be avoided. I am not aware of anything specific with COVID, maybe the drugs that are being used, but the general advice to patients who are G6PD deficient is that anytime they go to the hospital, that should be one of the first things they tell the doctor, that my child or I myself, I have G6PD defect. And then the necessary precautions will be taken, because some medicines cannot be tolerated by such patients.
Okay. Somebody says a friend went to LECMA for review and she was charged 5 Ghana cedis for COVID fund before she was attended to. You're asking if this is legal. Well, Doc will tell us whether or not it is. And you know, a lot of the messages that we're receiving has also got to do with issues that we've heard already, but generally the fear, people not wanting to show up. Maybe you can comment on the LECMA issue, and then I'll ask you the last question so we can address all the others that have come up.
The LECMA charging COVID 5 cedis for COVID fund. This is also something new I'm hearing.
Okay.
I'm not aware that we have given such a directive. Yes.
All right, Doc. So the point is we want to boost confidence so people can take their children or people can themselves visit the facilities. What's the plan? What are the nurses? Are the nurses wearing gloves? Are they wearing nose masks? What should be the appearance when I visit, when I go for my antenatal? What should the care be? What's the plan?
Okay, so when you go to the antenatal, what we are doing now is we provide hand washing facilities for all the staff and also for all the clients. So once you get there, you wash your hand, then you are screened the way we will screen any other patient to see whether you are a probable case of COVID. And if, you know, the screening shows that maybe you're a suspected case, then you would be directed to be tested. Also, we are making sure that all our health providers have the protective gear. Depending on where you appear, either the clinic or in the ward, the protective gear may vary, but minimum is the face mask. And in between attending to clients, they will wash their hands or sanitize so that they don't pass on to anybody. If they wear gloves, then they will change the gloves between patients. We are also making sure that all our clients, all patients, also have the face mask on before they come in.
Okay.
And yes.
If I'm taking my child for weighing, should the child be wearing mask as well?
Yes, the children also. So we should get smaller size ones.
Even the babies?
The babies, no. Beyond 2 years, yes, as much as possible. We try and make sure that they are also, because we want to protect them and protect everybody else who is coming to the clinic.
Okay.
And like someone said, I think from home, many of the health facilities have the masks available for sale if you attend. So let's make sure that we are prepared from home before we go.
Okay.
We are also trying to reduce the crowds. So sometimes, you know, in the past, we always say we have weighing sessions on a particular day of the week or a particular day of the month in the community. Now we are trying to hold the clinics more frequently so that we don't get large crowds coming in at a time. So we are doing all we can to reduce infection.
Okay.
If you are coming for routine services, you shouldn't go back, you know, with COVID.
All right.
So we're doing our best to minimize the infection.
Okay.
Exposure.
Doc, we've taken a bit of your morning. We thank you. I really appreciate that you spent this much time with us, taking all the questions and addressing them. Thank you very much. We wish you well.
You're most welcome.
And that's Acting Director of Family Health, Ghana Health Service, Dr. Isabella Sego Moses there. Well, just to remind you, it's a Thursday. You know, on Tuesdays and Thursdays, there's a briefing session on Ghana's COVID-19 situation. So there's another one. The advertised time is 9 a.m. So when it gets underway, we'll take you to the Ministry of Information. And today, the issues they've tabled: further clarification on hospitality sector openings, update on government engagement with stakeholders on potential post-restriction measures, and community spread advisory. So coming up is a briefing on Ghana's COVID-19 situation. Still ahead, we talk about hydration, nutrition and hydration. Remember, around this era, we're all told to keep hydrating ourselves. But apart from the water that we know you have to constantly take, what other mixtures can you make? We've got our dietitians, Nana Ejay. She's going to be sharing her special recipes with us, something that you can try at home. So you definitely have to stay with us. You're watching the AM Show.
And of course, it's Healthy Thursday, so we continue comprehensively on detailed health content. Okay, and if you go to the website of the World Health Organization, they have indicated for your nutritional needs, hydration, as well as making sure you eat right, become very important in these COVID times. And that's why we decided to bring on board a dietitian, Nana Ejay, to help us also have all these related conversations, because you do also know that apart from what we need to do, we also have our Christian, our Muslim brothers and sisters who are within the Ramadan period, and so we need to make sure they hydrate themselves, and within the period when they have to eat, they eat right. Now, Nana Ejay is joining us. Good morning to you, Nana.
Good morning.
Now, why is it important for hydration to be an important part of what we need to do for our nutritional levels?
Okay, thank you. Hydration is very important because I'm sure viewers may have heard about water forming a very large percentage, as much as 70 to 80% of the body. And there are specific functions that the fluid content of the body plays. So one important thing is that it cushions the joints in the body. So the various joints in the body have to be lubricated so that the bones don't rub against each other. So you need water in the body to help the body achieve that function. And the body also uses water in digestion. So you need enough fluid to help your body digest well, to produce the juices and things that are needed to digest the food that you eat. The body also regulates temperature with water. So if you're feeling cold or if you're feeling warm, the body uses water to cool down the body as it's required. Also, water helps us to keep our weight in control, especially if you are substituting your water intake for other sugar-sweetened beverages and otherwise unhealthy beverages that we would take. And then one very important thing is that water removes toxins from the body. And these toxins include bacteria and all the viruses and other things. So for your body to be able to clear waste substances and foreign material from the body, it also makes use of water.
And I was just going through the whole of yesterday evening, the site of the World Health Organization, especially for the Mediterranean region. And they advised on that side that apart from taking just ordinary water, natural water, you can also augment that with a lot of watery foods. Now, how does that complement that in the health sense?
So the body has a high requirement of water, and for a lot of us, we are not able to meet that requirement. Even for the average of 2 liters that we need for maintenance, it's difficult for a lot of people to take that in the form of plain water. However, there are lots of other healthy things that we take in that have water content, like fruits and vegetables, like watermelon, cucumbers that have enough water that can hydrate the body. So if you are adding these things to your food and you're using water in preparing other things you eat, like soups and porridges, for example, then the body absorbs the water from it. So it's not just plain water that the body uses. Provided you are not adding a lot of salt or a lot of sugar to whatever you are taking, the body makes use of the water perfectly.
That would mean that we need to find these sources. Which ones will be the appropriate ones in terms of the sources of the water, and then also where you can get foods that have the watery content that the body also needs?
Okay, so from the previous image that was shown, the glass depicts the various sources of fluid we can take. And the red, gold, green color signals show us how safe it is or how good it is to choose the various options. So as always, water is the first choice. And you have to ensure that you are taking between 1.5 to 2.5 liters daily. When it comes to water, aside the plain water that we take, you can prepare the infused water, what we call infused water. So you can have some fruit slices or some vegetable slices and add even some herbs like mint in your glass of water, infuse it overnight, and then it adds some flavor to the water you are taking. And then you also get some vitamins like vitamin C, which are water soluble, seeping into the water. Yeah, so you get an added benefit, and then you have that extra flavor for those who do not just like plain, boring water. And when it comes to water, I know people have some reservations about taking cold water, but really, for the average healthy person, there's nothing wrong with taking a glass of cold water if you feel like taking it, because your body can work on the temperature and bring it back to the level where it's supposed to be. So if you want a glass of cold water, feel free and go for it.
I'm usually an iced water person, and I get all these advice, if not cautions, from people around me, as well as even having these messages that come on WhatsApp frequently about how if you drink cold water and you have eaten some fatty food, it gets to have some problems for your body. How can we break those misconceptions?
I've seen some of those posts about water freezing the oil in your intestines or in your stomach, but the body is warm. Even when you breathe out and you feel it, you feel some heat or some warmth coming from within the body. So once the cold water travels and gets to your stomach, the body regulates the temperature. So it's not going to freeze the oil in the food that you have eaten, like people have been saying. So feel free to take your iced water if you want to.
Now, we have to come to terms with the use of the vitamins. There are people who are vegans, and then there are others also who want to go organic, and so they don't like the orthodox medicinal way of taking medications that the pharmaceutical industry produces. Any alternative they can have?
Yes, so fruits and vegetables are the ultimate source of vitamins. Like you're saying, most of the pills and supplements we will take will be manufactured forms of the vitamins. So you want to go in for your fruits and vegetables as often as possible. If you're taking your 5 servings of vegetables a day, whether in the form of your soups or your stews or your salads, you are getting enough vitamins. Once you are eating every meal that you are having with some form of vegetable and adding a fruit or two to your meals, you are sure that you are getting the requirement that your body needs. People who have to be worried about supplementation are probably pregnant women when it comes to their iron. Then they would need some form of supplementation because the body may not be able to absorb the iron that they need, everything from their diet. So they have to look at supplementation. And then people with certain conditions where they have problems with absorption of their nutrients, for example, people who have undergone certain kinds of surgeries may need supplementation as a requirement. But for the general healthy person, if you are eating enough vegetables and adding some fruits, you are sure that you are meeting your vitamin and mineral requirements.
And I know practically, look, these days we have a lot of blending machines all around, things that tend to do a lot of mixtures for us that you, the dietitians, call smoothies. A lot of people have come to love them. But by way of nutritional value to complement what we eat within these times, let's start with the fruity ones. How do we mix them? How do we also blend them, whether with color, with additives, etc.?
So as much as possible, the advice is to eat a rainbow in terms of the colors of the fruits that you are eating. Yes, so you can have different fruits that you can combine to give you different colors, like is shown in the picture. When you come to our setting, we don't have a lot of these exotic fruits that are being shown, but we have equally colorful ones like our mango, our watermelon, and other local ones, pineapple, pawpaw, that we can use. And a lot of the ones we have around here, the tropical fruits, are packed with a lot of nutrition. So when it comes to preparing your smoothies, if you are using it as a meal replacement, which some people tend to do these days, then you want to make sure that you have a fruit in there, you have some vegetables, preferably the green vegetables. So in Ghana, we have spinach, what people call boko boko. You can add that to your fruit. And then you can add a source of healthy fat. So you can use either peanut butter, what we call granite paste, or coconut fruit, so that you have some source of fat in the smoothie as well. And then if it's replacing your meal, then you can add something like oats, so that it becomes a complete meal for you. But you cannot take this smoothie I've just described after you have had your meal, because it's packed. It has a lot of energy, it has a lot of nutrients in there. So you're going to gain weight because you are adding on to what you've eaten already. If your smoothie is just going to be a snack or a refreshing drink for you, you can just do a vegetable smoothie. So something like a carrot juice, it's fine. Or you can do your cucumber with your apple mixture. Those ones are lighter on the calories, so you can take those. Okay. Or you just do one fruit. So you just blend watermelon. The issue with blending of fruits is about quantity. So a lot of the time, we like to take fruits in large quantities, ignoring the fact that the fruits also contain calories and natural sugars, which would add up to our total intake for the day. So if you're taking your fruits as snacks, you want to restrict the portions as much as possible and not overdo the quantities.
Okay, so we're opening the phone line. So we're putting the phone lines on your screen, and then you can also call us subsequently. If, for example, I particularly love using the local things that we have. So if you live in any of these communities we have, and you feel that you have identified, or there are certain staples or fruits or other vegetables that are also related to your community you would want to blend, our dietitian Nana is available for you to ask the critical questions. So the numbers will be on your screens too. Now, I know that we use that Wadawa, Prekese, and some of those things, and they've become a part of being used even for other sort of dietary supplements. How do we do that?
So it's all about quantity and doing things in moderation. A lot of these natural foods have medicinal properties, and they are very potent. So if you are combining, for example, you're blending dandelion with a lot of other things. I know people do some wild combinations. So they do dandelion with maybe lemongrass, have mint in there. That's a lot of nutrients. Ideally, it would be good, but in a large quantity, it burdens the body because your kidney has to do a lot of work to clear the waste that comes into the body. When you blend, you reduce the size. So if you are drinking, you take in more than you would have taken if you were eating as a salad or using in your stew, for example. So the advice I would give is that we shouldn't do these things daily. It can be something that you do maybe as a cleanse once in a while, but not as a daily thing, blending concoctions and take them every day.
Quite interesting. Oh, well, so the phone lines are still opened, and then you can call us, let us get to know. There are people who have peculiar nutritional or dietary needs, just because maybe they have chronic ailment or have some difficulties elsewhere. We have sickle cell patients, we have people who have kidney-related issues. What do they do in these times? Well, please wait. Let me take a call from East Legon. Christian is there. Christian, good morning to you.
Good morning. How are you?
I'm good, Christian. I'm good. Good to hear from you. You want to contribute to our discussion, or perhaps ask some questions? You can still go ahead.
Yes. It's about a question.
Okay, please.
I actually want to find out from our lady dietitian. There's this issue of, hello?
Please go ahead, Christian. She can hear you clearly.
Yeah. Concerning caffeine in our diet, most of the times you hear people telling us cafe is not good, cafe is not good. I want to know how truthful is that, because some of our herbs and vegetables that we take, some of them contain this caffeine, but people entirely condemn the use of caffeine. I want to know the truth in it. Thank you. Because I know we have synthetic caffeine, which is made up from the laboratory and all that. But yes, so we have caffeine in some of our natural teas like green tea, black tea, and all that. We have caffeine in them. So how do we? You understand? How do we?
Yeah, Christian, this is a true.
That?
Christian, this is a true East Legon question. Please, Nana, hold on to this. We'll take a next one from New Edubiase, and it's where Mina Hunter is calling from. Mina.
Yes, senior.
Yeah, boss.
My sincere greetings to you in the studio.
I take him, Major.
Yes.
So please go ahead. Yes.
We thank you for this educative program that you are organizing.
Thank you for encouraging us.
You know, we need to also have an update on fruits that do not blend. You know, all this while we just know that dawa dawa is good. We just know that cream is good. We just know that some lemons are good. But then blending them, some of the fruits and vegetables are not blendable. You blend them and you realize that it will become a toxin or it will become a poison to the human system. So we want Nana to help us to kind of identify.
Okay, Mina Hunter, so you are saying that there are some at least some fruits or some, you know.
For instance, I can blend almost 9 fruits. I will have my beetroot, I have my cucumber, I have my pineapple, banana. I blend them all together with some little quantities. I blend them all together. But then we want to know if they wouldn't have an adverse effect on the human system.
Okay. Mina Hunter, have you lived in India before? The way you keep blending things.
Have I lived in India?
Yeah.
Not really. I have a food and nutrition book, a healthy juices book.
Fantastic.
And that I kind of follow their guidelines. And I use it in kind of solving so many. I'm for one person who don't kind of like taking orthodox drugs.
Fantastic. You're an organic person. Thank you very much.
Type,
Thank you very much.
We want to know.
All right. So Nana, please answer. Christian says caffeine. Now, what do we do with it if they are already inherent in the product? And then Mina Hunter is saying blending. He has a 9-fruiter recipe going by his book.
Okay, so with the issue of caffeine, like he said, there's naturally occurring caffeine in foods like coffee and tea. Previously, it was thought that because caffeine is a diuretic is something that makes the body produce a lot of urine. So when you take something like coffee, it has that effect of making you pass urine. Previously, it was thought that the diuretic effect was very high. But current studies show that the effect is not as profound as we thought it was previously. So the advice is that with every cup of coffee you take a glass of clean or pure water, so that the urine that you pass will be replaced by that water that you are taking. So if you're going by that, you can take your teas and your coffee without any issues or any problems. The issues come when it's found it's the artificial kind that is added to some drinks, especially the energy drinks. A lot of them have these stimulants, and caffeine is one of them. If you take them regularly, then you may be putting more than your body can deal with into the body, and then it gives you the effects of irritability and keeps you awake and you cannot concentrate and all those negative side effects.
Second one, Mina Hunter with his diet book, fruit juice book.
So the key here is keep it simple. Keep it simple. As much as possible, if you're doing just one fruit and a vegetable, you should be okay. There's no need to combine as many as 9 fruits because you may be overdoing your sugars first of all. You may be overdoing some of the vitamins, some of the minerals. And I don't know exactly what he's combining, so I may not be able to talk about the interactions that are there. There are nutrient interactions that will occur within the body if you eat certain things together. But if you are keeping your smoothies simple and doing just the fruits or even eating the fruits as they come naturally, then you are sure that you wouldn't have these problems.
Okay, let's go to David. David, you're calling from where? Where's the place you're calling from? David? Oh, David is gone. Well, Na Lamioko. Na, are you online? La Lamioko. Na Lamioko. Na, are you online? Na, well, Na was also calling from Jamestown. Okay, so we do have from the Volta Regional Capital, Charity. Charity.
Hello.
Yeah, hi. You want to put some questions to Nana?
Yes, please.
Please go ahead.
Oh, okay. Please, I want to ask about moringa. How do you take in moringa?
Okay. Nana, you want to answer her? Okay.
Yeah, sure. So moringa is very healthy. It has good effects on your blood pressure, your blood sugar. The best way is to use it in your soups. And if you are using it in a stew, for example, if you blend, like I said, the risk of overdosing is high because if you blend a cup of moringa leaves, you get a very small amount of the juice or the smoothie from it. So if you want to take in a whole cup of moringa juice, that will be a lot. And it may be more than your body can deal with. And the issue with the kidneys is that you don't know the day where your kidneys will just go into an injury and just decide to shut down. So you want to stay safe. You want to help the kidney as much as possible by not overburdening it. So use it in your soups, use it in your stews, and you should be fine.
Right. Mohammed.
Yeah, Mohammed from Abekatra.
Assalamu alaikum. Are you fasting? Are you fasting?
Yes, please.
Great. So, good question. You're calling from Abeka. Please go ahead.
My question is, the benefits of prekese in this local attire, we call it the green tea attire. The benefits.
You mean the one we take in the Zongo? Because in Ashaiman, I take some attire. Hello? Okay.
Hello, I say ginger, prekese, and then in the mix-up with the benefits.
Attire, prekese, the mixtures.
Yes.
Okay.
The ginger.
Okay, we'll note that down. Auntie Alice.
Yes.
You're calling from Elmina.
Yes.
You want to ask a question? Nana,
yes.
It's
Sir, good morning.
Morning, Auntie Alice.
I want to ask Auntie Nana a number.
You want to have a number?
Yes.
Okay, so we will take your number and we'll
I'm a sickle cell patient.
Okay, so you want to know.
I don't take orange, some fruit. So I want to ask Auntie Nana what fruit I should pick.
Okay.
So if I can get Auntie Nana's number.
Right. All right. Okay, please. So Auntie Alice, we'll get in touch with you with Nana's number. Sule, you're calling from Konongo. Sule.
Pardon?
This is not pardon. Please reduce the number. Reduce the volume. Yeah. The volume on your screen or your TV. I think that will help.
I'm coming.
So reduce the volume on your TV. Have you reduced it?
Yeah, I have reduced it.
Okay, please, your question to Nana.
My question is, I do take lemon every day. Is it good for me?
Okay, please.
Lemon.
Please hold on. You do take lemon every day. Nana.
Yeah.
So you, Sule, be online. Nana.
Okay.
Yeah.
Sule takes lemon every day.
Does he take it raw? Or
okay.
Does he mix it with water? Sule.
Sule, do you take it raw or you mix it with water?
I mix it with water. I do drink. I put one in it and drink it.
Okay, so you squeeze one lemon in a cup of water, a glass of water, and you take?
Yeah.
Each morning?
Warm water, yeah.
Okay, warm water. Okay, so Nana, Sule does that. One warm water in a glass of water, and that's what he does every morning.
Okay.
What's the advice?
So it's fine, provided he doesn't have an ulcer or any condition that requires that he shouldn't take fruits like lemon, the citrus fruits, on an empty stomach. That's fine. If you're adding it to your water, the benefits you are getting is that you are hydrating yourself, first of all, and you are getting the vitamin C from the lemon in the water, and all the other nutrients that are in the lemon juice, you get them as well. But people do this with the mindset that it's going to burn fat in the body, especially fat around the stomach. If it's replacing your meal, you will get that effect because you have cut down on your intake, you have cut down on your calories. But the lemon juice itself does not directly cross from your stomach and then burn the fat that is lining the stomach walls. So that's one misconception we have to clear. If you are looking at burning fat around your abdomen, you need to exercise and you need to eat healthy to get that effect.
And the related issue about you trying to get the right sort of lemon and how warm you are saying that if you have other complications that you are not supposed to take, which will be those ailments?
Typically people with ulcers.
Ulcers?
And then stomach ulcers, and then there are people with kidney issues who, as and when their labs come in, they are required to stay off certain foods.
Right.
So those people would know that they are not supposed to take lemon.
All right. There's a question pending, but let me take two more before. That's Mohammed's question. Right. And Daniel from Navrongo and Abdullahi from Walewa. Let me start with Daniel. Daniel.
Yeah, good morning.
Good morning, Daniel. Your question.
Yeah, the moringa you are talking about, when you take the seeds of moringa, when you take it too much, you pay. I don't know whether it is good for you to take the seeds of moringa for you to pay.
What do you mean by you peg? You mean you'll be running?
You run.
You run?
Yes.
Okay. Okay, Abdullahi from Wale. Abdullahi. Okay, so Nana, let's start with the attire mixtures. You know, when you... Abdullahi.
Hello?
Yeah, Abdullahi, please ask your question.
Good morning.
Yes, please. Please go ahead. Reduce the volume on your TV sets. Reduce the volume on your TV, please.
Hello?
Can you hear me? Abdullahi?
Hello?
Yes, please.
Hello? Good morning.
Go ahead.
Yeah, please, I want to find out if your work doesn't permit you to eat normally you eat late at dawn. What can you possibly do to reduce the fat that you always accumulate in your body?
Okay.
And secondly, if you can think about the dietitian so that you can possibly give you timetable for like possible menu for a house so that you contain the fat you are accumulating.
All right. So Abdullahi, Abdullahi wants to know. He works longer hours, and so gets to only eat late, either in the evening or late in the day. He is asking, what does he need to do to make sure he burns the fat? What type of food should he be eating so that he doesn't accumulate fat?
Exactly.
And then he wants your number so that you give him a menu plan. But we'll do that one. But first, the attire, the mixtures, etc., that we drink in the communities. I like it a lot, so I need to get educated.
I'm assuming the attire is a herb, right? It's a tea.
Yeah, we mix it with also a little bit of caffeine and stimulants, and sometimes Percocet and things are mixed together for a lot of things.
Okay. So if it's a tea, teas have what we call flavonoids, which are good compounds that help the immune system to function well. So it would be a good thing to have. I'm not sure how much caffeine or stimulants that are in there, but if it's more than the body needs, then it would be something to watch out for. But the other things that are added, like ginger, Percocet, have a lot of different benefits. Ginger especially is good for the immune system, so it would be a good thing to add to your tea. Percocet is good for your blood pressure, so it would also be a good thing to add. And the thing with the tea is that I'm sure it will be brewed and the contents will be sieved out. So it's just the fluid that will be taken. So that's also fine. It wouldn't be too much on the system.
And now the gentleman eats late. He wants some advice.
Yeah, so like you mentioned, it's important for people who work late hours to eat healthy so they are not even accumulating the fat in the first place. There are certain foods that cause the body to build up a lot of fat. These are foods that contain a lot of energy or a lot of calories. So if you are eating fried foods, if you are taking drinks with your meals, like the soft drinks or what people call minerals with your meals, you are going to have extra calories with these meals. And if you are eating late at night, you have to reduce the quantity. So you don't eat a very heavy meal in the same quantity you would eat for lunch if you are eating it late at night. It'll be better if you...
Well, that's where we wrap up. And Nana AJ is a dietitian for the day. A Healthy Thursday. We've been tackling all related issues, health, and we started with a great conversation with Dr. Isabella Sego-Moses, who is in charge of Family Health Directorate at the Ghana Health Service and helping us with all those discussions as well. We have to take a break. When we come out, we'll bring you the latest showbiz interactions with Kadi, but you also know that we'll take you live to that press conference at the ministry for information.
Good morning, my name is Kadi and you're welcome to the Showbiz segment right here on the AM show. Now to my very first story, actor turned pastor Timothy Bentum has joined the call for the lifting of the ban on social gatherings so church service can resume. He explained that as a leader of his church, he's responsible for the spiritual well-being of his congregation and fears that many may backslide.
I think it will be inappropriate to speak for these men of God. I don't know the motives behind their pushing for the ban to be lifted. But if I have to speak for myself, the fact is that the flock have been given to us for a reason. And whoever comes to church, whoever God brings to you, is a soul that you have to account for. And the longer this ban on social gathering continues, the more likely it is for you to lose the person to either a lifestyle that's not right, and then when you reopen, they might not even come back to church again. The question most people ask is, okay, why can't you reach them through social media or through other means? Now, not everybody has a phone. Not everybody has the luxury of data always, and not everybody even has a phone that's a smartphone, so they can't reach you. They can't watch you on Facebook Live. There are people who have a congregation of say 1,200. How do they go and greet?
Now, Ketukwiku told, this week he actually told the Ghana Soccer Center of Excellence at Prom to inspect the progress of work done at the facility, which has been made available to government for the use as an isolation center.
Yes, now we are in the afternoon, but around 7:30 thereabouts, whatever falls on the ground, you can pick it, because you can see we've projected the 4 eyes and security lights all over the compound.
It's so good to welcome the president of the GFA here. At least ever since the place was given out, this is the first time he's coming here, and then work has gone on.
We've done carpentry jobs by polishing the wardrobes, filling in the broken louvers, changing the frames, the ceiling, and as I speak to you, we are not doing painting. which all the blocks have seen paints. The magnitude of work that have been done here have saved the Ghana Football Association millions of cedis.
This land especially, we've been fighting for so many years to fence it. And then just immediately when we heard that the ministry wants to take this place as an isolation place, the first thing they prioritized was to fence the place.
Our predecessors, they've all been fighting hard to do the fencing. But unfortunately, financially, we could not do it. But we, by giving this building to the COVID team, have given us opportunity to battle for it. We have 50 TVs that they delivered yesterday. They are going to bring fridges. They have mattresses about 100 here. They have 250 curtains here. As strong as I am, I'll fight for us to have a quantity here. If not all, at least we did not rent the place to them. And they are going to use the place as long as the COVID remains. And in the MOU, we are putting in that even when they have not exited and the national teams have a game and they want to come, Health Ministry will look for a place for them because we don't want to ship them. We look at Airport Side Hotel and other big hotels in Accra that were used as an isolation center or receptive center. Those hotels are going to be used again. They are not going to discard the hotel. That means there is a way to exit from whatever they bring in here. So by exiting, they are going to fumigate the place, put the place back into its friendly atmosphere.
Well, away from the locals, in tomorrow, the German Bundesliga will resume. And of course, we already know that the South Korea League, that's the K-League, has restarted, same as the league in Faroe Islands. And the German Bundesliga actually will be the first major European league to restart after the major leagues went on break due to the coronavirus. So we're going to go through and check. So, we are looking at when football leagues will return. And the German Bundesliga, tomorrow, God willing, is May 16th. So that is coming back. There's a proposed date of June 13 for the Serie A to return. And the Premier League, they are looking at somewhere in June. And for La Liga, it's still suspended indefinitely, although clubs have started training. The Major League Soccer, they are looking at June 8 as the restart date. And we already know that League One has been cancelled with Paris Saint-Germain awarded the title. The Dutch VC also cancelled as well. Okay, so now we know when some of the leagues are coming back, and then we also have to take a look at the relief for some of the countries, be the African countries in terms of football COVID-19 relief. So Mauritania, they've got a total package of $320,000, 14 Premier League teams, and this is how they're going to share it. So $7,043 per club, which means $282 per coach. And for 30 players in each club, each is going to get $141 per player. So for Gambia, there's a total package of $160,000, and that's going to be shared among 47 teams, and each club is going to get $2,910. Now to Cameroon, and yesterday we brought you the story of how they've also cancelled, they've become the latest African country to cancel their league. And so the total package there is $88,000 for 44 teams. Breakdown to be decided later. And Ghana, yesterday, GFA president, and as you heard this morning in our first story, was talking about how the Premier League cancellation will be based on government's advice. And this is a quote from him, and he says, "We're also waiting for FIFA to fast-track the process and get us an emergency COVID-19 fund. We are actually expecting two funds from FIFA, the FIFA Forward and the FIFA COVID-19 fund. Both are not yet in."